Hi, welcome to Wake Up Canada News. I'm Brad Wilder. Was Sheila Lewis murdered by a Canadian healthcare system that has lost their morals and ethics? Today we're here to tell you the real story behind the death of Sheila Annette Lewis, the Alberta woman who was denied an organ transplant because she refused a COVID-19 vaccine. Sadly, Sheila passed away August 25th, just a few days ago. That story and more coming up right after these here on Wake Up Canada News.
The taste of barbecue starts and ends with premium quality charcoal from Wild West Charcoal. Your taste buds won't be the same. The flavors, the texture, and the enjoyment of a delicious breakfast, lunch, or dinner. From the backyard to the campsite, only the finest charcoal direct from Paraguay, delivering a fire that's amazing to cook on. Perfect for beef, pork, chicken, and more. Wild West Charcoal. Available online at wildwestcharcoal.com.
Welcome back. Sheila fought to save her life and maintain her dignity to have informed consent without coercion, all for her basic and fundamental human right for equity under the law and respect for body autonomy when making medical decisions. In a recent interview, we spoke with Jane Scarf from Stand For Thee, and Jane shared her personal opinions as we discussed Sheila Annette Lewis's legal journey. Jane has a long history of social activism and has grave concerns about protecting Canadian culture, values, and Canadian sovereignty, using the Canadian legal system to do so. Jane was a caring friend and advocate to Sheila Annette Lewis. To be clear, Jane does not claim to provide any legal advice in this matter. Stand For Thee is a Canada-wide initiative created by Jane Scarf and Rebecca Shepherd to help educate Canadians about their human rights using the Canadian Bill of Rights. It's their intention to ensure that the government and its courts regard their obligation to operate based on the principles of common law we inherited from the British. First and foremost, Stand For Thee and Wake Up Canada News believe that our rights are natural and God-given. The government does not own our rights, we do. Neither the government nor the courts have authority to give us our rights or take them away. I asked Jane to give us a brief history of how she came to meet Sheila and how she heard about her case.
She contacted us after she lost the first level of her application. Her application was because the lung clinic at the University of Alberta refused, the doctors there made a decision to refuse her a lung transplant because she would not take a vaccination. And she told me that she had passed all the other medical testing to show that she was a good candidate for the lung. And I guess it's quite rigorous. You know, they don't just, do this in any case. They do it in the case of, and she was on the list. Initially, she was on the list. And then when the vax requirement stuff hit, they took her off and informed her because she wouldn't have a vax, they're not going to.
Because Sheila refused the vaccine, she was removed from the lung transplant list by the University of Alberta Lung Transplant Clinic. Jane, can you tell us how this case evolved and really what happened to Sheila with the Justice Centre for Constitutional Freedoms, the JCCF, otherwise known as John Carpe, and also the Alberta Premier Danielle Smith?
So the JCCF, Justice Center for Constitutional Foundation, Freedom, Constitutional Freedom, offered her to represent her in an application, trying to overturn that decision. And they used the charter, and they argued that the charter applied in this case and that her rights are violated. And at the first level, it was refused because the court said the charter doesn't apply to the doctors. because
Right.
the doctors are on contract to the university. But this is again not my legal opinion, but my assessment of this tells me that the university is government, so they are ultimately responsible, in my view, for what goes on in a clinic that is run under their umbrella. As well, the clinic was run on provincial funding, so the Alberta healthcare system was the funder of it. So charter, so charter to the university, charter to the province. And I think, unless Sheila didn't give me correct information, I think the charter also applied to the doctors, because Sheila said these doctors worked exclusively at this clinic. They didn't just pop in for the odd, consultation on contract basis. But what was argued by the province or by the university or whoever was presenting the opposition to Sheila's application was arguing that these doctors don't fall under the charter because they're on contract, so they're independent contractors. But the Revenue Canada won't let you be independent contractor if all your money comes from one source. Doesn't matter if you have a contract or not. It doesn't make you a contractor because, like, legally speaking, just because you have a contract, because every employee has a contract. So that doesn't mean every employee that has a contract is not an employee, they're a contractor. So we didn't see anything, might have missed it, but I didn't see anything in the paperwork that Sheila let us see that JCCF argued that. They didn't argue that. They just said, like, okay, well, they're on contract, yeah, okay, but they're under the charter. But they wouldn't be under the charter if they were in fact independent. Like, say if they had another clinic somewhere else and they had other clients and they did work here and there and all over the place, and for that clinic it wasn't the majority of their financing, then they would have been able to say they're independent. But I don't think they had that. I don't think they had that at all. So then when it went to go to appeal, Sheila had been doing a shitload of research about the Alberta Bill of Rights, and she deeply resonated with it and could argue it very effectively. And she told JCCF, I don't want you to use the charter on the appeal. I want you to just use the Alberta Bill of Rights. And they straight up refused, and they pressured her to continue to use the charter. And in fact, I would say not like they said, if she tries to go another way, like they refuse, they're going to do that way and that's it. If she wants to go off, break off and do something in another direction, she's going to be dead before the court hears it. So she needs to buckle up and comply with their direction, which is charter. And she didn't just say, oh, use the bill. She said why. This is what's wrong with the charter. It's got loopholes and it's in all of that. And she also said it should be just directed towards the clinic and the provincial government anyway. Like, it shouldn't be like, depending on whether the doctors are covered or not, they're working under the authority of the university and the government. But that didn't happen. They just stayed to their same script. And then this is the outrageous part, the absolutely part that just kills me still. After she lost at the second level, at the appeal level. Oh yeah, I should mention also too, when she lost at the lower court put a publication ban on Sheila. Sheila was not allowed to say publicly that she needed a lung transplant. That was forbidden. She wasn't allowed to mention the doctor's names. I would be mentioning them now, but I know them off the top of my head. She wasn't allowed to say lung clinic. She wasn't allowed to say lung clinic at the University of Alberta. And that was to protect those people, apparently. From what? From everybody knowing that they were participating in a political ritualistic murder. So anyway, after the appeal level decision, Sheila did some interviews because JCCF told her she couldn't interview. She wasn't allowed to. Only they could speak publicly. But when it was over, like she lost, it's done. They're not representing her anymore. It's done. She thought, okay, I can speak. So she did 2 interviews that I know of, maybe more. I'm not sure, but I know of 2 of them. And she was, speaking about what was happening to her and what she believed. And she also talks about the Bill of Rights and that she wants to do something just with the Bill of Rights. And she got, and we were helping her. We were wanting to go after Danielle Smith because Danielle Smith had made the statement that this vax discrimination or unvax discrimination against unvax was the worst discrimination she'd ever seen. She was going to introduce changes to the Human Rights Code to disallow it. And she had also told Sheila that she was going to help her. And she said she would help her by getting a medical opinion for her. And so, Sheila, appreciated that and then waited a really, really long time. And then Danielle Smith comes back and says, sorry, Sheila, the doctor that I got to look into it agrees with the clinic doctors, so can't help you anymore. And nothing else was done. And she was also asked to help Sheila with her pension because she wasn't getting any income for 3 years. She couldn't work. She couldn't even go out of the house. And she couldn't, and she was entitled to it from what I can see, but she didn't get it. And she asked for assistance, was totally ignored. JCCF didn't help her get it either. Completely financially devastated by her condition, her medical condition. And then this is if all that isn't bad enough, couple of days after the decision from the appeals court, and she did these couple of interviews, she gets this phone call out of the blue. And I remember this name. This name was Tim Bailey, and he's a lawyer. And he said to her that he heard about her case and he was concerned and he was willing to fundraise for her. And he knows some churches that would be willing to throw in, and what they're going to do is raise money so that she can go out of the country and have a lung operation. So she was thrilled with that. And he also said, and Danielle Smith is in the background of this. Okay. But there's one catch. You have to keep the JCCF happy. So you can't be doing interviews about your situation. And Sheila was just kind of backed away from us and said, okay, I'm doing this. I'm not because we were going to do a very public campaign against Danielle Smith. So all of a sudden Sheila's like, nope, I got it all going on now. I'm going to go this way. We ties our hands. We can't advocate for somebody that doesn't want advocacy. So about a month and a half later, she starts contacting us again. And I said, Sheila, what's going on with the lawyer's offer to raise money? She said, nothing. Absolutely nothing. So they just shut her up and didn't help her. Didn't lift a finger. Didn't try and get her pension for her disability pension. Nothing. And then JCCF offered to make an application to Supreme Court for Sheila. And John Carpe offered to pay for it. But if she wants him to pay for it, she has to sign an agreement. We have a copy of it, that she can't talk about her case in public. And if she does talk about her case in public, she's getting the bill. Isn't that lovely? And we raised money for her. And they even pressured her to give them that money. She used that money she was desperate for that money. She used that money for hydro bill, for food, right, stuff like that, because she had no income. And they actually got in her face and said they saw that we raised money for her, so she better give it to them. This is so JCCF. JCCF did that.
So now that she's passed, the gag order is no longer in effect. Is it true that these doctors who wanted to remain hidden from public scrutiny can now be discussed?
Well, yeah, it was only in Alberta that you couldn't discuss them.
So the time is coming that we will expose that here on Wake Up Canada News down the road here for sure.
Yeah, I'll get the names and I'll come back and give the names. I'm not trying to withhold the names. I just don't know them off the top of my head.
Look, obviously they wanted to hide from the public, these doctors, the associations involved, the NGOs. I got a question for our audience viewers.
I have one piece of information about after Danielle Smith came on the scene and made that big statement about how she was going to make changes to the human rights. She also was advising her peeps to respect that decision or that direction even before the Human Rights Code changed. So Sheila thought, okay, maybe they'll reconsider. So she called the clinic and she said she wanted them to reconsider in view of what Danielle Smith said. And they said, we don't respect what Danielle Smith said because she wasn't elected. She was just appointed in that position. So we don't listen to what she said. And I forgot, John Carpe also put in a condition of they're going to pay for the Supreme Court. She can't make any contact with the clinic. She's not allowed direct or indirect contact with the clinic.
Wow, they shut her up basically.
Yeah, shut her up and shut her down. So not only
John Carpe is an issue then, isn't he, with the JCCF? Yes.
Yeah. They were shooting her in the foot, and not just that they weren't helping her. Like that's one level.
Blocking her at every turn.
They were actually actively tanking her. Right. You know what I mean? Like that's different than just turning their back and not helping.
That's right.
They were coming forward and screwing her. Yeah. And then on top of that, they were taking steps to make sure she couldn't help herself. You know what I mean? We're going to tank you. And if you try to help yourself, we're going to make it worse for you.
Folks, do you know that you have to be vaccinated here in Canada to receive an organ transplant? But you don't have to be vaccinated to donate an organ. Another victim of the politicized medical establishment. On July 17, 2023, Sudbury, Ontario resident Garnett Harper died from kidney disease after he could not receive a transplant because he was unvaccinated. He left behind his wife and 5 children. His wife reported that she was shocked and dismayed when she was asked to donate her husband's organs for transplant while he was dying. Now, because organs must come from a live body, folks. Did you know that? What's wrong with our healthcare system here in Canada? Here's a quote now from the Canadian Blood Services website. A donor's vaccination status is not a requirement for entry to a collections event. Donors are not required to provide proof of vaccination, and we will not turn away unvaccinated donors, end quote. Jane, can they be held accountable?
I think that what they're doing is clearly illegal and it's negligence causing death. And the coroner has in Ontario, I'm assuming, I haven't looked yet, but I'm assuming they'd have the same thing in Alberta, where the coroner can investigate any factors that contribute to a death. And I initiated such an investigation here in Ontario with the Children's Aid. Their actions, it was a suicide, and their actions contributed to the suicide. And it was investigated, and steps were taken to address it.
Now, Jane, can you please explain more about your plans to request an open death investigation with the Alberta Coroner's Office? Maybe a brief explanation on what you hope to accomplish?
Yeah, I would use the facts that I've said. I have a recording, an audio recording of where they're harassing her to go with the charter and negating her request to go with the bill, just to go with the bill, including you're going to die. If you go that way, you're going to die. And she at the end of the conversation, she just knuckled under. And
do you think it would have turned out
the contract telling her to shut her mouth? If she wants them to help her shut her mouth in public.
Do you think the outcome would have been different if she stuck with the Bill of Rights instead of the Charter?
Yes. Because the Bill of Rights, like what's wrong with the Charter? Well, there's 2 things. No, I shouldn't. Okay, there's 2 problems with what they did as far as I can see. And the one is that they made the issue that the doctors weren't covered by the Charter. Well, even if the doctors weren't covered by the charter, so what? The University of Alberta is covered by the charter, and the Ministry of Health of Alberta is covered by the charter. So who cares that the doctors aren't? But I think the doctors are anyway, and I think they could have argued that effectively. But regardless, take them off. Make her whole case about the university and as if there would be no policies or structure or accountability coming from the university, coming from the province who's paying for it. It's not all up to the doctor.
Right.
It's the system did that to her. So it would be like, whoever was directly involved. Daniel Smith had firsthand knowledge, so she's personally responsible.
This would have started with Dina Hinshaw, right?
Dina, I don't see her directly with that. It would be her advocation for vaccine, I guess, but the doctors did that they said that it was a medical decision.
Okay. Which
was crap, because we had a doctor's report saying that a vax would put his client, it was in Ontario, would put his client at risk if they took a vax prior to, because there's risks to the vax, no benefit, like little to no benefit, because they could have done, like, if they were worried about she has COVID and she's going to give COVID to the nurses and doctors that are giving her the operation, all they had to do with that is give her isolation for 14 days in a hospital. That's it. That's all. Say goodnight.
Yeah.
And test her beforehand. Right? That's it. That's all. So they're out of the loop as far as I'm concerned. So it's only the risk to her. So it's nobody else's business. So
right.
even if they're right that it would put her at more risk if she didn't have a vax, it's not their business. It's her business. And in Garnett's case, they can't say, well, it's like general resources of, the community and the transplant, blah, 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 and we could give it to somebody else, whatever. Okay. They can't even say that in Garnett's case, because a relative offered to give Garnett, knowing that they were recommending he had a vax, they didn't care. So the donor didn't care and the receiver didn't care. So like it doesn't add up. So the Bill of Rights says you have the right to inform, like, it doesn't say, but it guarantees your right to informed consent. In Ontario, I don't know what the equivalent is in Alberta, but in Ontario, our Healthcare Consent Act means every medical application, it has to have the informed consent of the recipient. So it's not up to the doctor. It's their job to tell you, but if they tell you and you say no, then they shouldn't be doing it. And it's just like, and also equality, like 1B in the Bill of Rights. So you have Alberta Bill of Rights and Canadian Bill of Rights that say the exact same thing. It says every individual has the right to be treated equally and protected equally by the law. So if you're treating vax like this and unvax like that, that's a clear violation of that right. So that's what she wanted to argue. She wanted to argue that she had a right to informed consent under 1A, which she has that for both the Alberta Bill of Rights and the Canadian Bill of Rights, and 1B, same thing. That's what she wanted to do. And she wanted it continuously and how do you say, like, rationally. She knew why, she knew the case laws, she studied it very closely, and she told JCCF repeatedly to drop the charter. Please drop the charter. And they told her at one time, and this is on the tape, they had told her at one time, like, well, you can see that the charter usually loses at the lower level, but it often wins at the appeal level. For example, Arthur Pulowski, he lost at the lower level, and then he won at the higher level. And Rebecca looked it up and gave her some sections out of it, and it doesn't say that that's what happened with Arthur Pulowski. It's in the lower level. They did use a charter challenge and they lost, and then they went to appeal, and the appeals court didn't use the charter. They said they didn't need to use the charter because the injunction that he was fighting was illegal. So they overturned the injunction, and all the charges that were laid under the injunction were overturned. So it had nothing to do with the charter at all. It had to do with the fact that the injunction was unlawful. So Sheila went back to them and said that, and they said, oh, well, we didn't really mean that it was the charter at the second level. You just assumed that. Something like, no, they clearly said charter doesn't win often at the lower level, and it wins at the higher level. And then when she understood what was going on, they lied. They tried to gaslight her, say, oh, well, you misunderstood what we said.
We look forward to keeping an eye on your progress moving forward on this case. Now, shortly after this interview, Wake Up Canada News obtained Sheila's affidavit prepared by the JCCF and sworn to November 2021. We will name the names of the doctors that refused Sheila the lung transplant based on her COVID vaccination status. They also required Sheila's immediate family to take the COVID vaccines also. This is Sheila's affidavit, and I quote, on or about January the 3rd, 2020, the lung transplant program team also advised that I would need to repeat all of my childhood vaccinations because Alberta Health Services could not locate my vaccination history. I therefore took the hepatitis B, rotavirus, DTaP, influenza, type B, PVC-13, inactivated polio, influenza, MMR, VAR, hepatitis A, and HIV-Mense, plus required boosters. I even agreed to take the H1N1 vaccine, which was not part of the regular childhood vaccinations. I completed the course of those vaccinations and boosters from January the 10th, 2020 through December 31st, 2020, while waiting for my lung transplant surgery. End quote. These doctors wanted Sheila to take these vaccinations to hopefully improve the lung transplant outcome, to have the best chance for a successful transplant. It was well known, though, by this time that the injections did not prevent transmission nor prevent anyone from contracting COVID. The injection does nothing to prevent the virus, if there is indeed such a thing. Don't believe us? Christine Massey's FOIs reveal that the health science institutions around the world have 217 and counting, have no record of SARS-CoV-2 isolation, purification anywhere ever. None exists. A link will be in the show notes to her website. You can look for yourself, folks. So was Sheila's death the best outcome? Now the University of Alberta Hospital LTPT doctors, the team includes Dr. Rhea Verghese, Dr. Dale Lean, as well as Dr. Justin Weinkoff, Dr. Ali Kapasi, Dr. Kieran Holloran, and Dr. Alim Harij. Recently, Conservative Party leader Pierre Poilievre came out and said that Sheila Lewis's death, because she was denied an organ transplant for not wanting to get a COVID-19 vaccine, is a failure of medical ethics. As head of the Conservative Party in Canada, that's the absolute height of hypocrisy. Of course, Poilievre would have known exactly what was going on in Alberta, as that's his home riding. Danielle Smith was placed into her current premier position, and all decisions would have gone through and been approved by Poilievre. Political grandstanding. Now a comment from the Ontario MP, Roman Barber. And I quote, "The Canadian Health Act forbids discrimination, but Sheila Lewis was denied transplant because of a lawful medical choice," Barber said on Twitter, now known as X. He continued, "Her death is a tragic failure of the medical ethics and the administration of justice. I'll work to right this wrong until the last day of my career. Rest in peace, Sheila," Mr. Barber said. End quote. Too little, too late. People in Canada are being left to die by the medical establishment because they choose to make a medical choice that the establishment disapproves of. Sheila's just another sacrifice on the altar of political power, folks. She's no different than the thousands sacrificed over the past 3 years as part of the COVID scandemic. Canadian political party leaders got their orders and they carried them out. No doubt they were backroom deals between Danielle Smith, the JCCF, and their political masters. The only thing that matters to them is their re-election and political power. Every action, every statement is calculated to get maximum votes. Towing the party line, partisan politics, Danielle Smith got her orders and she carried them out. They don't care about you or your family. They care about themselves and the ability to hold on to power as long as they're able. Politicians deal on trade of souls and lives. Sheila was a pawn in their game, maintaining power at all costs. Heavily invested in the fake COVID narrative, these Alberta doctors, politicians, and courts are doing everything to obfuscate their guilt. Many of us have been watching this poor woman's plight. Karma is going to be a bitch. We here at Wake Up Canada News wanted to honor Sheila by telling you the truth of what actually happened. The real inside story of how the Canadian medical establishment has been politicized and controlled by the World Economic Forum and the World Health Organization. I'd like to thank our journalist, writer, Sane Lady, for investigating and writing this story for us here at Wake Up Canada News. Thanks for watching. I'm Brad Wilder. Remember to like, share, subscribe, and donate as we continue to tell the truth Canadians need to hear now. Remember, you're the voice. It's time to make it count. I'll see you next time.